Friday. Everybody loves Friday. Alright, let's go. Go. Do you have like the notes from like the last one a couple weeks ago? It was like C diff? Yeah. Oh yeah. Can I get a picture of that? Can I get a picture?
A C. diff infection is caused by Clostridioides difficile. This is a gram-positive, spore-forming anaerobic bacteria. It produces two toxins, TCDA and TCDB. An infected person sheds the bacteria in their feces. It's an opportunistic pathogen, so it infects people after having an antibiotic treatment. The spores it produces can survive a long time on surfaces and are difficult to kill. The infection is spread by ingesting the spores. This bacteria is found naturally in the environment. It's found in air, water, soil, and it's found in some human or animal feces.
Did I remind you? Don't write in pen. Let's do a top hat question. Hey, I got it right. Let's go. Come on.
This pathogen enters through the mouth and it attaches because it produces toxins that attach to the lining of the intestine, specifically epithelial cells. It overcomes host defense because it infects the large intestine. It doesn't come into contact with blood antibodies. In addition, the patient is immunocompromised either due to antibiotics that kill off bacteria in the colon or due to old age. It damages the host by producing toxins that attack the lining of the large intestine. In addition, the toxins destroy cells and produce patches of inflammatory cells and decaying cellular debris inside the colon. It exits through the host through fecal matter.
Symptoms usually develop a few days after an antibiotic is started, especially broad-spectrum antibiotics. Colon can become inflamed and may form patches of raw tissue that can pus or bleed. Also may cause severe inflammation and enlargement of the colon and sepsis. Mild to moderate symptoms include watery diarrhea 3 or more times a day for 2 or more days and mild stomach cramps. Severe symptoms include watery diarrhea 10 to 15 times a day, intense stomach cramps, increased heart rate, fever, blood or pus and bowel movements, nausea, and dehydration. If a healthcare professional believes that a patient has C. diff, they will order a stool sample which shows toxins produced by C. diff. Stool should only be tested if the patient has diarrhea. Enzyme immunoassay is able to detect toxin A, B, or both. It is an easy and inexpensive test.
Clostridioides difficile can be treated with vancomycin. Vancomycin is a glycopeptide antibiotic. It is used for the treatment of serious infections caused by gram-positive bacteria. Vancomycin works by killing bacteria or preventing their growth by inhibiting the polymerization of peptidoglycan later composed of N-acetylmuramic acid and N-acetylglucosamine. Recommended dose is 150 milligrams 4 times a day for 10 days. To prevent Clostridioides difficile, make sure to wash hands with soap and water, especially after going to the bathroom. Showering with soap and water. Obtain care early if you are aware of an infection. Disinfect areas of contamination by wearing latex gloves, using Clostridioides difficile sporicidal agent to disinfect areas. Disinfect all areas of contamination, including toilets. Wash hands with soap and water thoroughly. You need to make sure to also create daily cleaning protocols for all areas of possible contamination. Notify all individuals that are in the area of infectious individuals to make sure they wash hands thoroughly and shower with soap and water as soon as possible.
for today. Reminder, your top hat is due next Thursday. We'll have another teen disease presentation on Monday. Have a great weekend. Everyone loves Fridays.